Your child has a cough and a runny nose. At first, you figure it's just a common cold. But then, day by day, their breathing gets a little faster. They don't want to eat. And that mild little cough starts to sound alarmingly deep. While the flu can hit your family like a ton of bricks, RSV is more of a silent creeper that can escalate into a serious breathing battle. In this video, we're going to break down the 7 sneaky signs that your child's illness might be RSV, and what you need to watch for that proves it's playing a different and potentially more dangerous game. Every parent knows that sinking feeling when their child gets sick. The late nights, the constant worry, and the endless question, is this serious? Should I call the doctor? That confusion gets even worse in the fall and winter, when all sorts of respiratory viruses are making the rounds. The flu is a well-known villain. It often shows up suddenly, with a high fever, body aches, and an unmistakable level of misery. A kid can go from playing happily in the morning to being completely wiped out by the afternoon. It's a fast-moving storm. And while both the flu and RSV can cause severe illness, the way they operate is very different. RSV, or respiratory syncytial virus, is a different kind of threat, especially for babies and toddlers. It doesn't always announce itself with the same drama as the flu. Instead, it often tiptoes in, disguised as a harmless cold. And that's what makes it so sneaky. While the flu can feel like a full-body assault with aches and chills, RSV often wages a focused, escalating war on the lungs. Understanding its subtle tactics is key to protecting your child. First difference, the misleading start. Excessive sneezing and a runny nose. The first sneaky sign of RSV is how it can look like a very, very runny cold, but with an intensity that just feels different. A cold brings on a standard runny nose, and the flu can sometimes cause one. But RSV often kicks off with a literal flood of nasal secretions. We're talking about a nose that runs like a faucet, producing so much mucus that it can be incredibly tough for a little one to handle. This isn't just a small hassle. For a baby, it's a big deal. Infants strongly prefer to breathe through their noses, especially when they eat. So when their tiny nasal passages get completely clogged with the thick mucus RSV is famous for, it sets off a chain reaction. They can't breathe and eat at the same time. You might see your baby try to feed, then pull away, crying in frustration because they can't get enough air. This is one of the earliest clues that you're dealing with something more aggressive than a simple cold. The sheer volume of sneezing and mucus is RSV's opening move, a sneaky first step that looks like a common illness, but is actually setting the stage for bigger trouble. Second difference, the deceptive timeline. The day 3 to 5 severity peak. The second, and maybe most classic, sneaky trait of RSV is its timeline. The flu often hits hard and fast, with symptoms peaking in the first day or two. You usually know you're in the thick of it almost immediately. RSV, however, plays a longer, more deceptive game. An RSV infection typically starts with what seems like a mild cold. For the first couple of days, your child might just have a little cough and a runny nose. You might even think they're on the mend. But with RSV, the worst is often still to come. Symptoms usually hit their peak on days 3 through 5 of the illness. This is when that mild cough can turn deep and wheezy, and when breathing difficulties can really start to show. This slow escalation is a classic RSV signature. It can lull parents into a false sense of security right before the illness takes a sharp turn. A child with the flu is often at their worst right away, but a child with RSV might seem to get sicker and sicker as the days go on. This progression is a critical sign that sets it apart from the flu's sudden punch. Third difference, the telltale sound, whistling. As RSV progresses and travels from the nose and throat down into the lungs, it often brings its signature sound, wheezing. This isn't the junky, rattling sound of a chest cold. Wheezing is a specific, high-pitched whistling noise that you'll most often hear when your child breathes out. That sound is a direct result of bronchiolitis, which is the inflammation and swelling of the tiniest airways in the lungs, the bronchioles. And RSV is the #1 cause of bronchiolitis in infants and young children. Think of those tiny airways as little drinking straws. When they get swollen and clogged with mucus, air has to force its way through a much smaller opening, and that creates the whistle. While a flu cough can be dry and hacking, this wheeze is a hallmark of RSV. You might hear it when your child is sleeping, or when they're upset and crying. It's a clear audio clue that the virus has moved into the lungs and is starting to cause real problems. Fourth difference, the visual alarm, visible work of breathing. This next sign is, without a doubt, one of the most frightening things a parent can witness. A baby can't tell you they're struggling to breathe, so their body shows you. Doctors call this an increased work of breathing, and when it happens, it's an undeniable sign of a medical emergency. The most obvious sign is something called chest retractions. This is when the skin and muscles in your child's chest literally suck inward as they fight to pull air into their inflamed lungs. You might see the skin pulling in between their ribs, below their rib cage, or even in the little dip at the base of their neck. Instead of their chest and belly rising and falling together, you might see a seesaw motion, where the chest sinks as the belly pushes out. Along with retractions, you might notice their nostrils flaring with each breath, trying to pull in more air. You could also hear a soft grunting sound with every exhale. This is the body's way of trying to keep the airways propped open. This visible, physical struggle for air is an emergency. While severe flu can also lead to pneumonia and labored breathing, this dramatic work of breathing is a classic sign of severe RSV in babies and toddlers. It's proof that the battle has moved deep into the lungs. Fifth difference, the lingering ghost, the month-long cough. Even after the fever breaks and your child starts to feel better, RSV can leave behind a very stubborn calling card, a nagging, persistent cough. A flu cough usually gets better as the other symptoms go away. But an RSV cough can stick around for weeks, sometimes for a month or more, long after the main infection has passed. This happens because of the inflammation and irritation the virus causes to the delicate lining of the lungs' lower airways. Even after the body has cleared the virus, those airways can stay hyperreactive and twitchy for a while. This leads to a deep, often wet-sounding cough that can disrupt sleep and daily life for a long time. Parents are often left wondering why their child is still coughing so much when they seem to be over the worst of it. It's just another one of RSV's sneaky traits. The acute illness might only last a week, but its impact can linger. There is also a known link between having severe RSV in infancy and a higher risk of developing asthma later in childhood, though it's still being studied whether the virus triggers asthma or simply reveals a child's predisposition to it. Sixth difference, the silent danger, inability to breathe and drink. We touched on this earlier, but it deserves its own section because it's one of the most insidious ways RSV can land a child in the hospital. A baby's whole job is to eat, sleep, and breathe. RSV systematically attacks their ability to do all three, but it's the dangerous intersection of eating and breathing where things can get serious, fast. As we mentioned, babies need to breathe through their noses to feed effectively. When RSV causes both severe congestion and rapid breathing, a condition called tachypnea, it becomes physically impossible for them to coordinate sucking, swallowing, and breathing. They'll try to drink from a bottle or breast, become breathless, pull off gasping for air, and become more and more exhausted and distressed. This quickly leads to poor feeding and dehydration, which is a major red flag. Key signs of dehydration include fewer wet diapers, like going more than 8 hours without one, crying with no tears, and a dry mouth. While the flu can cause dehydration from vomiting or diarrhea, RSV's method is sneakier. It's not that they can't keep fluids down, it's that they physically can't get them in because they're working so hard just to breathe. For many infants, it's this inability to eat and stay hydrated that requires a hospital stay for IV fluids and other supportive care. Seventh difference, the hidden threat, neurological complications. For years, RSV was seen as just a respiratory virus, but newer research has revealed another sneaky trait, its ability to affect the nervous system. While these complications are not common, RSV has been associated with issues like seizures, often with a fever, apnea, where a baby temporarily stops breathing, and encephalopathy, which is a general term for brain dysfunction. Studies have found that a small percentage of children hospitalized with RSV experience some form of neurologic complication. It's important to know that RSV is not unique in this. Other viruses, including influenza, can also cause these issues. Researchers are still exploring exactly how RSV does this, with one leading theory being that the virus may find pathways to the central nervous system. For parents, the key takeaway is to watch for any sign of extreme lethargy, unresponsiveness even after a fever is controlled, or any seizure-like activity. These are signs that warrant immediate medical attention. Recognizing these 7 sneaky signs is all about shifting your mindset. With the flu, you're often fighting a loud, obvious invader. With RSV, you're watching for a subtle saboteur. It's that gradual worsening, the distinct wheeze, the visible work of breathing, and the inability to feed that are the true red flags. The great news is that we now have powerful new tools to protect the most vulnerable infants. These include a maternal RSV vaccine given during pregnancy and a protective antibody shot called nirsevimab for babies. Both have been shown to be highly effective at preventing severe RSV and keeping kids out of the hospital. If this was helpful, please consider sharing it with another parent, caregiver, or grandparent. It could truly make a difference. And don't forget to subscribe for more evidence-based content to help you navigate parenthood with confidence.